Well, there's thousands of failed medical theories every century, going back 5, 6, 7, 8,000 years ago, the days of the pharaohs. And the 20th century and 21st century are no different. I mean, there are some bad failed theories in the 20th and 21st centuries. And so the gene concept is being taken over by epigenetics. Now, genes do control the color of your eyes, the color of your hair, the color of your skin. They will determine instantly when the sperm fertilizes the egg whether you're going to be an XX female or XY male. And, of course, genes will determine that your liver, as it's maintaining itself, will make liver cells, and determine that your heart makes heart cells and skin makes skin cells. But there's no genetically transmitted diseases. Okay, this is called epigenetics. Let's have a look at this. I do want you to get a hold of your Longevity associate and ask them for the book Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Dead Doctors Don't Lie, and the book Rare Earths Forbidden Cures. Those three books together will set you on the rails to be able to prevent and reverse as many as 900 different diseases. Okay? Obviously using vitamins, minerals, amino acids, fatty acids, herbs, aromatherapy oils. Okay, that's the books Epigenetics, Dead Doctors Don't Lie, and Rare Earths. Now, one of the things we want to look at is, let's just look at something really simple like type 2 diabetes. I was on a big project with the National Institutes of Health, and Marlon Perkins from the old Mutual Omaha Wild Kingdom show did 20,000 autopsies. It started in 1967 and went for 12 years, and did 20,000 autopsies, 17,000 and some change of over 454 species of zoo animals, 3,000 human beings, 10 million chemistries looking for pollution, and 10 million slides of special stains looking for pollution and genetic problems. It turns out that every animal and every human being that dies of what we would call natural causes dies of a nutritional deficiency disease. No genetics, no pollution. Well, let's look at genetics. Look at type 2 diabetes, thought to be a genetically transmitted disease. One of the things I began to see was type 2 diabetes in crocodiles. Now, how would a crocodile, a poikilotherm, a cold-blooded reptile, if you will, get a human genetic disease? It didn't make sense. I began to see hummingbirds and deer and antelope getting sickle cell anemia, again, a disease thought to be genetically transmitted primarily in the black community, causing hemoglobin problems and dysfunctional hemoglobin, so your cells will sickle under certain circumstances. Well, it turns out that all of these things are nutritional deficiencies of the embryo. Sickle cell anemia is a deficiency of particular nutrients that are required for your bone marrow to manufacture the mechanism to make good hemoglobin. Well, if that's dysfunctional, then you produce dysfunctional hemoglobin. Okay, it has nothing to do with genetics. And then, of course, there's type 1 diabetes. Instead of having 500,000 beta cells to make insulin yourself, you might only have 5 or 10 or 50 beta cells, and it's just enough insulin to squeak by when you're a little kid. But when you get up to be 10, 11, 12 as a teenager, going through puberty and growing, doing a lot of physical activities, suddenly now that little bit of insulin isn't enough, and you'll be diagnosed with type 1 diabetes. Those are called inborn errors of metabolism. Thought to be genetically transmitted, but really just birth defects caused by nutritional deficiencies of different parts of the embryo as it's developing these biochemical processes. Things like lactose intolerance is another one. Fat storage disease is another one. Tay-Sachs disease, these kinds of things are all just simple nutritional deficiencies of the embryo early in pregnancy, the 3rd to 7th week of pregnancy. Totally preventable. Okay? Same way with Down syndrome. 1 out of 700 American babies are born with Down syndrome. It's not genetically transmitted. It's a simple nutritional deficiency of one mineral. Okay, in the first division, after the sperm fertilizes the egg, you're a one-cell human being. You go to 2 cells or 3 cells or 4 cells. Suddenly now, if you don't have that mineral, the mother can't make the system in the baby that produces enough insulin, and so they become a type 1 diabetic. Well, type 2 diabetes is a simple deficiency of a single mineral. We've known that for 80 years, and it's easily prevented and easily reversed. Even, sometimes people are born normal, or at least clinically normal, and then when they turn 25, 30, 40, 50 years old, they'll develop type 2 diabetes. Again, this is not genetic, even if every generation, the last 5 generations of family have it, it's not genetically transmitted. It's because you have very little of this mineral in the foods to eat from local soils, because that mineral's deficient in the soil. And then these people tend to be gluten intolerant. And so that increases the problem, because when you have gluten intolerance, it changes the lining of your intestines, reduce the efficiency of absorption. So what if you're only absorbing, say, 10% because your intestines are damaged? Well, 10%, 2% isn't very much. And so this is why you have generations of people with type 2 diabetes. It's certainly not genetic. Well, what I want you to do, again, is get the books, Epigenetics, The Death of the Genetic Theory of Disease Transmission. The book Dead Doctors Don't Lie, and the book Rare Earths, Been Cures. It wouldn't hurt to get a CD called Public Enemy Number 1 and a DVD called Somebody Needs to Go to Jail. You know who that is, of course. That's the doctors, especially the OBGYNs. Well, stick with us. We'll be back with Dead Doctors Don't Lie, and more truth, justice, and the longevity way after these messages.
The antioxidants found in many fruits and vegetables are known to help support and promote good health. Research has also shown that dark chocolate, once known as the food of the gods, is rich in healthy nutrients. In fact, dark chocolate is higher in antioxidant content than any other food. Longevity has combined a proprietary blend of velvety rich dark chocolate with whole fruit pulp and whole fruit juice extracts from mangosteen, goji or wolfberry, acai berry, and cherry, along with vitamins and minerals, producing a smooth, rich, delectable concentrate called Cocogevity. It tastes so great, I sometimes drink it right out of the bottle or pour it over ice cream. Cocogevity is highly bioavailable, meaning your body will absorb and make use of all of these healthy nutrients. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the health benefits of drinking coffee. Longevity has now taken it a step further with an entire product line of healthy coffees from Longevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium hand-selected Arabica coffee beans grown in the finest regions of Latin America, all carefully roasted, creating a delicious, rich, full-bodied flavor. Try JavaFit's Immune Plus, a full, robust coffee blend combined with the immune-supporting benefits of echinacea and the full-spectrum daily requirement of vitamins and minerals. Boost your immune system every day with JavaFit's Immune Plus multivitamin coffee. Available in 30-count single cup or 24-count single pot packs. Contact your local Longevity distributor to get Javalution coffees. And don't forget to ask about the home-based business opportunity.
You perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or 2 with a couple of vitamins. Longevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Longevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Okay, Doug, let's go to your pearls of wisdom.
Okay, I thought we'd talk a bit about some people that have been exposed to tuberculosis, possibly in California. Headline of this CNN story reads, 350 infants may have been exposed to tuberculosis at California Hospital. And this all happened at the Santa Clara Valley Medical Center in San Jose, California. Said an additional 368 mothers or parents and 308 employees were also exposed, potentially. So that raises the total to close to 1,000 people. So it was they notified in mid-November that one of their employees was suspected of active TB. The employee who worked in the newborn nursery was placed on leave. According to Stephen Harris, a chair of the pediatrics, in a statement said, while the risk of infection is low, the consequences of tuberculosis infection in infants can be severe. That's why we decided to do a widespread testing and start preventative treatments for these infants as soon as possible. And a little later in the article, they say illness is spread through the air when an infected person coughs, sneezes, or spits, and the germs are ingested by an uninfected person. It's possible to be infected but not be ill from the TB. According to the CDC, they said that there were 9,421 cases of TB in 2014, and they said that is treated with antibiotics from long, prolonged periods. If not properly treated, it can be fatal. The medical center said that it's reaching out to mothers who were in its care between mid-August and November, providing testing and preventative daily treatments for the infants. Any mothers or parents and employees who are possibly exposed will be screened. See, most, if not all, the employees have been screened already, and there have been no positive tests so far, according to spokeswoman Joy Alexu. A nurse who was who may have exposed the TB underwent annual screening in September, which was negative, and then later her doctor found TB when she underwent an evaluation for an unrelated medical issue. Nurse's condition is not known at this time. I find it interesting. They're kind of doing a little backpedaling there and saying, no, nobody's been infected. We haven't found any employees. But, this woman just had, or this nurse at least, had a test back in September, so that's just a couple of months ago, and now tests positive. So, a couple months down the road, all 1,000 of these people could possibly test positive.
Well, exactly. And there is some delay between the development of antibodies from exposure, so there's a time delay, and so that is possibilities. And of course, many people are exposed to tuberculosis, and you can find antibodies in them later on, but they're not clinically ill, but they have low-grade smoldering tuberculosis in their lungs or their intestines and things like that. It's a very insidious disease, and of course, they should be screening these people in these hospitals for tuberculosis tests yearly, or maybe even every 6 months in a place like in the baby nursery, because these kids are so susceptible to things like this, and they can certainly die if they get it in their lungs. It's a very, very terrible respiratory disease. It can be a systemic disease. It can go to the brain, it can go to the liver, and so it is very, very dangerous. And I appreciate you bringing that up. And here's a case where personal hygiene, of course, and the Pure Works is very important, especially with mothers nursing baby killer biotics. She should be taking a couple of those every day, pass some of these herbs on to the baby to make sure the baby's well, and we can save our kids. But the experts, Doug, are saying that our children will be the first generation that do not live as long as their parents. And we're going to have to be vigilant. We're going to have to do things because the USDA, the United States Department of Agriculture, says that Americans, or 95% of all Americans, are minerally deficient. And again, they say our babies will be the first generation of Americans that do not live as long as their parents. And, of course, baby formulas have less than 20% of the minerals and vitamins necessary for optimal development. Dog food has 100%. Rat food has 100%. Chicken food has 100%. Our babies have less than 20%. We have some work to do here, and the medical system has failed us, so we have to do it. Thank you for bringing that one up, Doug. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
All right, let's head to Colorado Springs, Colorado. And Hal, you're on with Dr. Wallach.
Hello, Hal, you're on the air.
Yes, Dr. Wallach. I've had shingles and Grovers for almost a year now, and do you think that would interfere with the absorption of your minerals?
Okay, well, tell me about Grovers. How does that manifest itself? I'm not familiar with that.
It's just little, places that itch.
Oh, itchy spots. Okay. Mm-hmm. Okay, that's useful information, actually. Okay, how much do you weigh, sir?
About 90, right about 100 pounds.
Okay, and how old are you, sir? What is your age?
75 or 76. Yeah, 76.
Okay. And let's see, we got your weight. Do you have any other issues, any diabetes or high blood pressure or arthritis?
No.
Okay.
Blood pressure is slightly on the low side, I suppose.
Okay, so low blood pressure. Okay. All right. Okay, did you have asthma as a kid?
No.
Did you have your appendix out?
Yes.
Yes, okay.
I was 2 years old, but so, I guess.
You were how old?
Oh, I guess I was about 10.
10 years old and had your appendix out. Okay, that'd be pretty typical. Yeah, you have what's called gluten intolerance. This causes itchy skin, it causes constipation, it causes diarrhea, it causes things like low blood pressure. It will cause you to have your appendix out, irritable bowel syndrome. All this stuff are symptoms of a gluten intolerance. When you get 3 or 4 or 5 or 6 or 8 of them, then definitely you've got gluten intolerance. It's an absorption problem. So the first thing I have you do is change everything you're doing as far as eating. You have to give up fried foods, no exceptions. No deli slices with nitrates and nitrites. That means no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. That's going to get rid of those inflammatory things. And then you have to give up oils. It means microwave popcorn, theater popcorn, things like olive oil, coconut oil, margarines, mayonnaise, salad dressing, cooking oils. And lastly, no gluten, no wheat, no barley, no rye, no oats. This would include dog food, cat food, bird food, spouse, mother-in-law, renters, anybody living in your house. And hang on, we'll come back with you and give you a supplement program for your problems after these messages. Okay, Doug, let's go right back to Colorado and Hal. Okay, Shar, are you there? This is a Shar thing.
I'm here.
Okay, this guy has skin problems, kind of a eczema over his chest and his back. That's the Grover's disease.
Yep.
And then shingles, okay, which is a chronic viral infection of the skin. He has, let's see here, low blood pressure, which is a mineral deficiency. And he's only 100 pounds and 75 years old. All right, and so he's had his appendix out. What did you do for this guy?
Well, obviously the first thing is to get him on a gluten-free diet, and then I would give him, for the shingles, he needs to put colloidal silver on it topically, and he needs to take killer biotic internally, and he should get on a, I guess if he doesn't have any other problems, just get on a Healthy Start Pack.
Okay. What would you do for his immune system? Get his immune system up in addition to the Healthy Start Pack.
I'd give him the BTT 2.0 capsules.
Good, excellent. And what else? Good for the heart, good for the brain, good for the liver.
Oh, the selenium.
Well, there you go. Exactly. So at 100 pounds, Hal, you need one Healthy Start Pack, as Shar says. Get yourself 2 bottles of our Ultimate Selenium. Take 3 at breakfast, 3 at dinner time. And the Killer Biotic is going to support your immune system and actually has antimicrobial properties and can kill bacteria and viruses and so forth, which includes shingles. And I'd go ahead and take 2 or 3 of those twice a day. That's 2 bottles a month. And topically on top of the shingles, as Shar said, you get our Envision Colloidal Silver and soak a cotton ball 2 or 3 times a day and keep that shingles area, even if you don't see the blisters anymore, it's just painful. You can go ahead and soak those areas, keep them wet with the colloidal silver for about 10 minutes, 2 or 3 times a day. And let's see here, for the itchy skin from the Grover's disease, just for a little bit of symptom relief, what would you do for the itchy skin, Shar?
He could put CM cream on it.
You get an A+. Okay, yes, I'd get you a couple of bottles of wide mouth jars of the CM cream, and you can go ahead and smear that on lavishly over the places that are raised and bumpy and red and itchy. And, within 5 or 10 minutes, you're going to get significant or total itchy pain, discomfort relief for 3 to 5 hours, so you may have to apply it 2 or 3 times a day. But on a gluten-free diet, within weeks, you should be free of this sort of thing because these are all secondary to a gluten problem. Okay, here. Doug, do we have time to start another one?
We're just about at break time.
Okay. Well, I'll just remind everybody that you want to get a hold of that book, Epigenetics, The Death of the Genetic Theories of Disease Transmission, the book, Hell's Kitchen, and the book, Rare Earth Bin Cures, and learn how you can lose that half a pound to 2 pounds a day and keep it off. That's the books, Epigenetics, Hell's Kitchen, and Rare Earth Bin Cures. And stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to New Jersey. And Joanne, you're on with Dr. Wallach.
Oh, Joanne, you're on the air.
Yes, I spoke with you last Friday about our 7.5-year-old Siberian Husky who has closed angle glaucoma and heart arrhythmias, and he's on Origin grain-free dog food.
Mm-hmm.
And you were giving me the names of some supplements, and you needed the name of the food that we were giving him.
Sure, okay, and how? Yeah, and this is designed for large breeds, is that correct?
Yes, he's 95 pounds.
Okay, but I mean the dog food is specifically made for large breeds. Is that correct?
I believe it is. It's a Canadian outfit.
Well, that doesn't mean anything. You need to read the label or call the 800 number and see if that's their one for large breeds, because you can have an average dog food, and they're assuming the dog weighs 35 pounds. And so it may be short on minerals if it does not say formulated for large or giant breeds, which gives them more minerals. So it's very important. So there'll be an 800 number on that package, and give them a call. And they probably make one, but if it doesn't say on the label that it's formulated for giant breeds, it probably doesn't. But let's see here. Char, what would you give a 95-pound dog for a supplement program?
Well, I'd give him the Arthrodex, of course.
Mm-hmm. And how many scoops for a 95-pound dog?
I think 4, right?
Exactly. 1 scoop for 25 pounds. It'd be 4 scoops a day in the food. And for an irregular heartbeat, what would you give him for an irregular heartbeat?
For an irregular heartbeat, I'd give him the glucogel.
Okay, with your back problem, it's probably good, especially for a large breed, absolutely. They get a lot of back problems and hip problems. So I'd get 1 bottle of glucogel, so you could have 5 or 6 of those a day. And what would you do to make sure that the blood's flowing happily through the heart?
I would get him on the Ultimate Daily and the Niacin Plus.
Perfect. Yeah, I'd go ahead and give him 3 of the Ultimate Dailies, so 1 bottle is going to last 2 months. The Ultimate Daily tablets. And you can either grind them up and put them in the food, or you can throw them down his throat and rub his little throat, and he'll swallow them. Or as Shar said, and you can give both, would be our Ultimate Niacin Plus. It's non-flush, so it's not going to disturb the dog with flushing and itching, and it's time release. And it has all kind of wonderful herbs and enzymes in there to help dissolve blood clots and things like that. And so give us a call another couple more weeks and let us know how the pup is doing. Okay, Doug, let's go to another caller.
All right, let's head to New York. And Alex, you're on with Dr. Wallach.
Well, Alex, you're on the air.
Yes, hello. I have a question about my dad. He's 53, 6'1". He weighs 220 pounds. He has several issues, but I think this part is important. He used to weigh a lot more, so he went through a surgery to cut part of his stomach.
Okay, so he had a gastric bypass or something like that?
Yeah, I think it was called the sleeve. So when I tried to give him the one of the supplements for the knees, he would get heartburn, so he stopped taking it. Mm-hmm. But basically, he has knee pains. He gets sort of tingling numbness, knees and down into his feet, and his eyesight is worsening.
Okay, and let's see here, eyesight. Okay, all right. Shar, this is a Shar thing. Here's a 63-year-old guy, 6'1", weighs 220 pounds, has knee pain, knee problems, and it radiates down into his legs and stuff like that. What do you think is causing that?
Basically, he's got osteoporosis because it's blocking, it's hurting the nerves and stuff, and he's not getting blood flow.
Okay. Is the pain in his knees and the pain down in his legs, is that really due to pain in the knees, or is it from a back problem?
Probably a back problem.
Yeah, I think you're right. I think it's a peripheral neuropathy, and causing this pain down. As soon as you start saying numbness and tingling down the legs, that's usually a neuropathy, low back stuff, degenerative disc disease. Do you know if he shrunk any in height? Was he 6'5" at one time, and now he's 6'1"?
He has went down maybe 2 inches.
Oh, so he has shrunk 2 inches. Well, there you go. And so he has degenerative disc disease. That's what's causing this numbness and tingling down his legs. And so what would you do for a 200-pound guy, Shar, with peripheral neuropathy of the back?
He needs 2 healthy bone and joint packs for sure.
Very, very good. Yeah. And let's see here.
And get on a gluten-free diet.
Okay, perfect. And what would you do for his eyesight? What would you add to this for eyesight?
I would give him the selenium and the Vision FX.
Okay, very good. So Char's exactly correct, Alex. I'd give your dad 2 of the healthy bone and joint packs per month. Be 15 glucogel a day. That's going to deal with the knees and all that kind of stuff. And each one will come with a wide mouth jar of the CM cream, which you can have place on his back and the knees. And it wouldn't hurt to get the trauma oil. Put 6 drops of trauma oil in about a teaspoon of the CM cream and apply that. You'll get some really deep pain relief. And let's see here. As Shar says, I would definitely give him the Vision FX, 3 of those twice a day. That's 2 bottles a month. And let's see here. Let's just go with that. And give us a call in a couple of weeks and let us know how he's doing. And we may have to add something or tweak something. This will get him started. But also, as Shar said, he's got to get on a gluten-free diet. No wheat, no barley, no oats. No fried food, no processed meats with nitrates and nitrites. Absolutely no oils. It means no theater popcorn. Absolutely no microwave popcorn. No olive oil, coconut oil, margarine, mayonnaise, celery, cooking oils. And that will reduce the inflammation, which contributes to this discomfort and whatnot. And certainly it can contribute to problems in the eye, glaucoma, macular degeneration, even things like cataracts. So we've got a little bit of work to do here, cleaning up his diet and getting him on the supplement program. But give us a call every couple of weeks and we'll walk you guys through this. And stick with us, folks. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to Battle Creek, Michigan. And Donald, you're on with Dr. Wallach.
Hello, Donald, you're on the air.
I'm very healthy. I've been on your product 2 years, 85 years old. I have a serious problem of insomnia and restless leg, a type of restless leg syndrome, and puffy soles. It feels like cushions on the bottom of my feet. I have some cramps at night, and my legs feel heavy and hot.
Okay.
I stopped taking prescription sleeping pills a couple months ago, and I think that's had something to do with it. And I am now
how much
taking.
Do you weigh?
Pardon?
How much do you weigh, sir?
140.
Okay. And how tall are you? How tall are you?
I'm 5'5".
Okay. And you're about to say something else?
No, I forgot what it was.
Okay.
I am taking melatonin, and I'm taking some restless leg pills from the health food store.
Yeah, but it's not helping you much.
Well, I still got the problem.
Yeah, I was going to say, otherwise you wouldn't be calling me. Okay, here we go. Shar?
Yes?
What is restless leg syndrome?
It's a lack of calcium.
Yeah, and of course it happens primarily, Donald, when you lay down. Is that correct?
Yeah, it's only a nighttime thing.
Mm-hmm.
When I lay in bed, and I usually I can get to sleep fairly easy, but if I wake up, which I have to do a couple times a night, then I can't get back to sleep, and then my legs feel very bad.
Yeah,
well,
you have to get up.
Don't do much kicking. You know,
okay. We have to move forward here because we only have a moment left here. We want to get to what we're going to do here. But when you have to get up several times, it can actually be the same thing that's causing the restless leg syndrome, squeezing the roots of the nerves that control the bladder. Oftentimes in a man, the doctor will just say, oh, it's a prostate problem. But I don't know what you say to a woman with the same problem, right? It's not a prostate problem. It's a back problem. And so what would you do for Donald's back problem, Shar?
I would give him the healthy bone and joint pack.
Absolutely. I'd go ahead and I'd give him 2 healthy bone and joint packs, Donald. That would be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. That's designed to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And then what would you do for him to help him sleep at night?
I would get him the Sleepies.
Well, there you go. I'd go ahead, as Shar said, get yourself a bottle of Sleepies and take 2 or 3 of those about a half hour before you lay down. And you better be close to the bed because you will get sleepy really quickly. It's just really a great product for helping people. It has about 4 herbs in there that actually make you sleepy. And so people are really interested in this product. You don't want a CPAP machine. You don't want surgery. You don't want any of that kind of stuff. But the Healthy Bone and Joint Packs will just help a lot with everything here. The restless leg syndrome, the cramps, okay. And let's see here, the restless leg syndrome, yeah, that's all going to. And also the numbness and puffiness in the bottom of your feet, that will go away too because that's all part of this peripheral neuropathy thing. And give us a call every couple of weeks if you would here, Donald, because you will be a great testimony. It's a very straightforward thing, and certainly we don't want you to get any surgery. And hang in there and call us back in 2 weeks and 4 weeks and 6 weeks. You'll be a great testimony. You'll help a lot of people. Okay, Doug, how much time we have?
Get about 20 seconds.
Okay, well, 20 seconds. I'm just going to jump in here. Remind everybody, if you want to add 25 to 50 healthy years to your life, get a hold of the book Epigenetics, the book Immortality, and the book Rare Earths Men Cures, and learn the secrets of the top 20 longevity cultures and why they have 40 times 100 rules we do. Don't forget, if you don't have any problems, if you don't know where to start, you can't fail by starting with a Healthy Start Pack, 1 per 100 pounds of body weight. Well, thank you, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many of Ancient Legacy's oils come directly from families in the East which have been distilling essential oils for over 100 years. For life's everyday aches and pains, such as sprained ankles, pulled muscles, and other bumps and bruises, try Ancient Legacy Trauma Oil, which contains essential oils traditionally known to help with pain, swelling, and inflammation. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Longevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the whey shakes again, the chocolate whey shake. And you need to remember, the whey shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. That's toll-free, 1-888-379-2552. And if you're a coffee drinker, or you use energy drinks, or you use sports drinks, or you use them all, you want to get a hold of that book called Energy Crisis. It goes into the active principles, the good things about coffee and green tea. Of course, we have our own line of coffee, both in the roasted bags. Okay, talk about that book often enough. Dead Doctors Don't Lie. It was actually written to respond to skepticism about the original audio cassette tape, Dead Doctors Don't Lie. So we made the book, my wife and I made the book, Dead Doctors Don't Lie, and put a lot of details in there to show people where they... Okay, and so the book, of course, Energy Crisis is a thing that actually makes it easy to understand how the coffee works. Again, we have the bags of the roasted coffee. We also have the K-cups, the little individual servings if you only want to make one cup at a time. We have the flavored coffees. My favorite, of course, is the premium roast hazelnut cinnamon, and I prefer the premium roast, of course. And then, of course, we have all kinds of energy drinks. We compare our energy drinks with those other ones out there. We have the wonderful Rebound, which is the only sports drink with 100 nutrients in it. We compare it biochemically and how it all works with Gatorade, which has 2, and Powerade, which has 6. I think 100 nutrients is better than 2 or 6. So contact your Youngevity associate, get a hold of the book, Energy Crisis, and understand how these wonderful products work, and drink more of our Java.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.